On your first visit to the office, you will fill out a health form that will give an overview of your general health history as well as the main reasons for your visit or things you would like to improve about your health. Some people have only 1 or 2 items that need to be addressed, while someone else may have a dozen. You will be interviewed and briefly examined to further clarify the reason for your visit and to determine which acupuncture points will be best for you. The stainless steel needles used are made specifically for acupuncture and are only used one time. A licensed acupuncturist, or LAC, is required to pass an exam on clean needle technique as part of the licensing requirement. The needles are very fine and flexible, about the size of a human hair. The needles are used one time only. After treatment, the needles are removed and disposed of. During treatment, you will rest with the needles in place. Most patients are able to relax, sometimes very deeply, during this part of the treatment. The needles usually stay in place for about 30 minutes, but the time can vary depending on your particular needs. After treatment, you will be given suggestions for self-care and a follow-up treatment plan. For example, a person who woke up with severe neck pain a week ago would have a different treatment plan than someone who has had severe neck pain for 5 years.
I know acupuncture might seem like a bit of a strange idea to some people, especially people who haven't grown up with it as a form of medicine. Actually, it's ancient. It's been around a couple thousand years. The simplest way I can describe it is that acupuncture moves the electrical energy, and the electrical energy moves the blood. And it's not a strange sort of energy. You have electrical energy in your body. It runs your heart, it runs your brain. What the acupuncturist does is direct that energy to the place that needs the healing. I was surprised to learn how extensive the training is for a licensed acupuncturist. I thought I could just, do a little study and learn how to do a few needles. I was pretty amazed to learn it was 3 years full-time with a lot of studying. It's about 3,000 hours, about 400 or 500 hours of clinical work under close supervision. And then after graduation from that program, there's national boards, and they're not unlike the boards I took when I was a nurse, as far as they're very highly regulated boards. And then after boards, then you get licensed by the state. I would say come in and get a treatment and experience it yourself. Most people are very surprised and often delighted with how comfortable they are during the treatment and how well they feel when they leave. They almost always feel more relaxed. Oftentimes their symptoms are reduced a little or significantly with one or two treatments. If for something more severe, more chronic, it'll take more than one treatment, but basically you don't know until you try it.